Okay, what are your feelings about depression as an individual?
I think depression is oftentimes overlooked. I think that as an individual, many people don't know what depression is. They don't know how to link it between like thoughts of extreme emotion going one way or another. It's just it's just a very general and vague term that nobody knows what it is. And so I also think it's something that's popping up more, like left and right. There's some sort of mental health instability, and depression's linked. It's linked to everything.
Think that it's always been this prevalent, or it's becoming more prevalent, or if it's because of like social media that we're more aware of it? Or
I think it's always been there. I just think that people were able to push through it a little better. I do think social media has definitely a huge impact on it, because if you're thinking one way of yourself and you go on social media and somehow you're going to find something that kind of proves your line of thought, your way of thinking, then that puts you even further down. It's very difficult to bounce back up and to build yourself up if there's so much building down on social media.
Yeah, the reason why I asked that is because it kind of seems like people will just throw around the term depression, like it, and they don't necessarily understand it, so they'll kind of be like, "Oh, I'm depressed," but it's like, are you, or are you just saying that? And I think that affects the people that are actually depressed, is when people are just like throwing the word around. And I don't know, that's something I've noticed more. Like it's kind of like a expression now than like an actual feeling. Do you kind of feel the same way?
I think so too, but also at the same time, I also think that those who actually are depressed, they're the ones that aren't saying it.
Yeah, exactly.
And so you would think with that way of thinking that, oh, there's more people saying that they're depressed. You would think that like the ones who actually are depressed, like we don't know what the spectrum is, and like how like there are multiple levels of depression. You don't know, and there isn't really I don't think there's a true way in knowing and being able to tell and identify that. But I do think that any extreme sense of emotion, like extreme sadness at one point in time, that will be like depression. Like if your grandparent dies and you're that low, that extreme sadness, are you depressed or are you sad?
Yeah, or is that just like a normal part of life that everyone goes through? It's kind of hard to know. I think that when people use it as an expression, people who are really depressed look at them and be like, "Oh, this person doesn't have the same type of depression that I do, so maybe I'm not depressed if they're saying they're depressed," you know?
Yeah.
I don't know. I think it's hard.
Definitely. And measuring up to other people, that is a huge cause for like that self-esteem, the confidence levels to go down. And it's tough, like what you mentioned earlier with social media. Like people only really post the happy on social media. They're trying to show off their lives when in reality they can actually be depressed too.
Yeah, and then you're comparing yourself, and then as well as just like comparing your depression. And like you said, depression doesn't seem to be the same for everyone, and more people are prone to it than others. Going back to kind of people just throwing out the term like I'm depressed, do you think there's an overdiagnosis of depression?
I don't think so. I think since there was the lack of like follow up in knowledge and research on it growing up, it just wasn't really diagnosed. Like you wouldn't know if you had depression unless you went to see somebody specifically for that reason. So I feel like that's partially why the word gets thrown around, because it's not really being diagnosed. It wasn't really a big thing it wasn't a big deal. And so now that it is, probably because more people are using the term, but what I've found or noticed, a lot of the people that I know that use the term depressed have ended up going to the doctor.
For depression?
Yeah, for depression.
So then they probably have some type of understanding about what that word actually means.
Yeah, I just think that now in society too, everyone has a sense of depression. Like there's always going to be something that will bring you down. It's just, are those things that can bring you back up, lift up your spirits, or not? And I think that kind of is the thing to determine.
Yeah. How is depression viewed in the African American community?
I think it's changing, but for the most part, like my generation, so millennials and younger, it's to us, we were like raised with it. It's kind of a thing, but our parents, our ancestors, they've gone through so much like hardships in their life and still made it out. Like I'm gonna say all right, because I mean, like, we don't really know how they dealt with whatever situations they were put into, but I think because of that, in the African American community, we don't feel the need to express our depression because we don't have life as bad as they did.
So would you say that it would be harder for you to express that to somebody older than you because they have had it worse? Like, do you feel comfortable talking to other African Americans who are older than you about depression?
I would personally. It took me a while to get to that point because I mean, like, there's a lot. Like, I've been through like quite a few phases of my life with like my mental state, and so like I have, but like in high school, that definitely would not. Like, I was not comfortable with anybody.
Do you think, if you could generalize, which not necessarily supposed to do, but do you think that as a whole, like, younger African Americans would feel comfortable talking to older African Americans about depression because of that kind of, like, what we were saying before, like, they're okay, so.
I think the disconnect would be younger and, like, grandparents.
Okay.
I think that's where you'll see a little bit of that separation because, kind of like I mentioned earlier, younger people, we were kind of born or raised into this era of mental health. And so, like, we're more open to talking about it versus, like, our ancestors, grandparents, who weren't in that. And they were just lucky to be, like, living their lives at that point. So it would be difficult to kind of relate to one another to be able to be comfortable to express that.
Have you ever heard any, like, comments in your life or anything like that regarding, like, oh, depression's not a thing, or, oh, you'll be okay, like, other people have had it worse?
Yes.
Particularly from African Americans?
Yes, actually, from my dad. For a while, because in high school I found out that I have really bad anxiety, and like, I think my doctor recommended, oh, you should go see a therapist, or he was like, either see a therapist or invest in a coloring book. And so my dad was like, oh, my daughter, she doesn't need a therapist, like, there's nothing wrong with her. But like, to that point, there actually was something wrong because I was mentally causing symptoms to myself. So I was causing harm to myself. So that definitely is, like, the overall bigger picture. And my dad, he's, like, from Houston. He has those southern like, it's totally different upbringing than somebody who was maybe, like, born in Seattle. Like, my mom is totally different. So, yeah, I think it's definitely there.
That kind of goes into my next question. Would you be willing to see, like, a provider? So when I see a provider, like a somebody that would either prescribe you medication or like a counselor of a different ethnicity than you?
Maybe. I have a tough time thinking about seeing like a therapist or a counselor because every single person I know ends up medicated from those, and that's like my main like setback, or I don't know, I guess what would prevent me, because a lot of those medications aren't that great for you in the first place. And like if you have bad anxiety and you take anxiety medications, then and if you have depression, it like increases your depression, and then there's suicidal rates. So being that I have a history of both, I choose not to, but I would be more comfortable talking to somebody of another skin color, somebody who I feel like went through similar hardships, because like even today with social media or with the terms now like white privilege or stuff like that, there's so much backlash with all of that stuff, and a lot of times people can't relate or identify with you, so it's like I may say something and like I would believe that they may think like a counselor wouldn't be able to be as perceptive as I would like for them to, because they wouldn't have experienced some of the same.
Do you think, again, this is like a generalizing question, but do you think that most African Americans would probably feel the same way? Or have you ever heard anything or talked to anybody about that? Their thoughts on it?
I think that a lot of them would feel very same. Actually, I think a lot of them would have stronger feelings towards that. So I grew up in an interracial family, so like everyone's like all different skin colors, so it's not as big of a deal in my family, but a lot of people, like minorities, tend to lump together, and so it's kind of like stranger danger. Like I don't know who you are, so I'm not like comfortable in sharing like and being vulnerable, because in the African American community you don't let people see your weakness, and that is a weakness. Your mental state is a big weakness, and so you always have to put on this like hard, tough front, even though you may not be.
Do you think that part of it has to do with like a lack of like African American providers, like counselors and such, so then people don't really seek out help because they feel like there isn't somebody that would be able to relate to them?
Yes and no. I think first it starts at home, getting those conversations, and I think you can kind of talk through it there, and then from there, then maybe there's more that needs to be done, like seeing a provider. But I don't think it's really gonna change too much, because the problem is actually getting like African Americans to see somebody for it. And so like once you get to that point, I don't think that it would matter as much, because then once they've made that realization, then like they decide they really need help. And so I know me personally, I don't go looking for African American providers, and so I wouldn't imagine I would look for a therapist of my, like if I've decided I'm to that point where I need to see a therapist, I don't think color would matter. Like I have a preference, but I don't think that would prevent me from going to see them.
Okay. Yeah, because the one thing that when I was doing my research was kind of like the access of like healthcare in general, and it seemed to be just like that there's not a lot of access for African Americans to seek mental health treatment that they would feel comfortable with, because it's just not necessarily out there.
Right, and it's kind of crazy because I kind of work in the industry too, so a lot of my clients provide mental health, and just seeing like behavioral health increase. Mm-hmm. It is one of the fastest growing services, and it is now increasing in these more urban areas. Mm-hmm. So it'll be interesting to see how that how that will like transpire.
Yeah. Too. And like you said, you know, with like everything kind of going on in society, white privilege being something that's very prevalent, you know, talking to somebody who is white, they might not understand like what you're going through, but then at the same time, I'm just kind of reiterating what you're saying just to make sure I'm getting it right. At the same time, once you got to that point that you think you would, that you were like, okay, I need a therapist, you wouldn't look at color necessarily, even though your preference would be somebody that would understand your struggles.
Or somebody of like any hardship. Like you really have to know somebody. Like you just have to be comfortable with that person either way. And so it's all one thing about this, it's all about perception. And so like I can't just like go out screaming like white privilege. Like yeah, there is a difference between skin color, but you still don't know what that person's been through.
True.
So I think it's just about like being comfortable first and making like I'm sure if somebody's like in somebody's community and they were different colors, but I'm sure they'd be comfortable with like talking about these things to someone else.
Yeah.
I think though something that is tough about that is other people talking, like once people know you went to see a therapist, like I mentioned before, weakness, vulnerable.
Yep, you're seen as that.
Yeah. And so now you're less of a person because you weren't strong enough to handle this.
And do you think that's that doesn't matter like with who, like what race, or that's just a societal thing? Or do you think it varies?
I think
on different levels.
I think it varies, but at the same time, I think it's stronger amongst, I'm not going to say African Americans, I'm going to say people of color in general, like Asians, blacks. I can speak on those two very specifically, and like knowing like I'm friends with a lot of white people, and like they've all have seen some sort of therapist or something, and it's no big deal that they did that.
Yeah.
And it's interesting because my sister and I had a conversation a couple years ago about us like actually like going to see a therapist, because I mean we both have different problems, but a lot of this stuff is hereditary, and so it's linked. And like when I like go back and think of my family, I'm like, well, let's hope I don't end up like grandma.
Yeah, definitely.
She's crazy.
Yeah, I think as also being biracial, white and Puerto Rican, I think that between white people, it's so much more common to just be like, throw out there like, I see a therapist, like my therapist, my whatever, my depression medication. I think that is just kind of like the norm, and you know, I think there's a lot of reasons for that. I think part of it, you know, statistically, white people have more access to things, so I think maybe that's part of it. But yeah, with like my mom, like I know my grandma suffered really bad with mental health, and I've never really dug really deep into that with my mom, and I don't know why, but like with my stepmom, she's very open about mental health in general and like seeing somebody, so it's kind of interesting how that plays out.
Yeah, definitely. My grandmother has quite a few things. I don't even know how many mental illnesses that she has. I put that in quotes because I'm not 100% sure if they were diagnosed, but I know at least a few of them were. And just to see like what comes down, and it's funny because my sister went to the doctor. We all share the same doctor, and he was like, "Oh yeah, your brother has ADHD, and a lot of times that's linked to anxiety." And then like my sister, somehow she came out of that appointment with like anti-anxiety medications. Oh, because she was going to talk to my doctor. One of the things she talked about was anxiety, and like I have my anxiety too. So like all those things are linked together, and like if there was more access to that in these urban areas, but the thing is, in the urban areas there's not access to a lot of things. Like it's not just like mental health, it goes to like finances, preparing yourself for the future. So it's like all of these things added together kind of puts like weight on the situation in whole. But even though African Americans, even though this like, I don't want to call it a stigma, but kind of, even though that's happened, you still see a lot of times like there's no outward consequences. Like a lot of them do, like they still live their lives. The suicide rates aren't as high, and like you don't see a lot of like rage or like killings because I was in love with somebody and they left me. There's not as many of that in the African community.
I mean, if you look at the news, anybody that's doing massive shooting of any type is usually a white male.
Yeah.
Which is the most privileged of us all. So
right. And you know
really
what?
Interesting.
So it's just, it's a definitely interesting thing to talk about. And it's not just skin color though. My coworker is from Bulgaria, white skin. Him and I had the same conversation about it, and the Bulgarian way of thinking is how the African Americans think of it here. He was like, you just gotta like saddle up and keep going.
Yeah, I think what I picture when I say white, I think of like an American, you know, born, raised in the United States, because I mean, even though Bulgarian is considered like white, they have a whole nother struggle that they come from. Oh, I was gonna ask you one more thing. I can't remember what it was. Oh, how do you think, like, what do you think is the solution to this problem? If you could, I know it's kind of like a deep question, and it could be so many things, but what do you think would help?
So, something that's kind of cool, it's already been implemented a little bit in like a few of, at least the middle schools around here, and I know a lot of my clients are starting to do this, is they have a provider on campus, like at the schools, like, I don't know, 2-3 times a week, to talk to students. And actually, like, I know at least students level, that's really been taken to. As far as like the generations that don't speak of it as much, that's a tough one, because they're already like, they're kind of stuck in their ways already, and so we have to get them out of those ways and kind of just talk and approach them. And honestly, I think just maybe communication. I don't think that there's any like program or anything that can really be done at this point, like for those baby boomers. Like they're stuck in their ways, especially in the African American community, because they think, oh, I've lived my life for this many years and I'm okay. It's like, I'm doing fine. But I think it can just, as far as now, just talking and like getting those feelings out, we have to change the perception of depression.
Yeah, and I think that's great, like getting kids who are young to understand it. And school is a very good place for that to happen, because no matter what their parents believe with depression, or if they don't want to talk about it, at least they're getting that knowledge there. And like I said, like access to healthcare in general, like any kind of healthcare, depending on your income, your race, everything like that, you know, it all depends on that. So if we can help people who may not get access to those services in the schools, then that could be very helpful.
Yeah, and like a lot of times people want to do like the pyramid, like top down, but if you get those kids early, like, then they talk to their parents, and then their parents become more comfortable about having these conversations.
Yeah.
And also with the whole access, a lot of people do not know the resources available to them. Like, the clients that I audit, the health centers, they offer sliding fee scales. You can self-attest, like, I don't make this much money. You could pay between $5 and $10 for a behavioral health visit. And all that isn't known. And there are so many FQHCs out there. It's like there's resources there. It's just getting them
access to it.
And just the knowledge out into these communities, which is very tough.
Yeah.